Welcome back. Again, I'm joined by Bonnie Johnson and Dr. Sweet from the Rockford Spine Center. Thanks so much for joining me this morning. Now, we're talking about TFAR. It's a newly discovered spinal surgery. And Bonnie, you were lucky enough to have Dr. Sweet who did the surgery on you. And now you're able to come here, stand on 2 feet, walk. You said your husband says you're a new person. Tell me about what life has been like after the surgery.
Well, since the surgery, I mean, the pain, once the recovery process started, it was just gradually getting better until now I'm at the point where I don't even have to take a Tylenol. There is no pain. I've been active in doing the things I could do before. I've had a personal trainer for quite a few years, and I had to stop that prior to the surgery when things got real bad. And now my trainer has told me that just 1 year post-operation that I am stronger than I was prior to the surgery.
Unbelievable.
So, yeah, I just feel so fortunate.
And you know what strong is like because you were a former owner of the Gymnastics Academy of Rockford.
Right.
You've been around gymnasts your whole life.
Right.
I mean, it's life-changing. I can't even imagine going from being in a wheelchair to being able to walk.
Right.
That's unbelievable. Now, Dr. Sweet, this surgery probably isn't for everyone.
Yeah.
Can you tell me how do you guys gauge who's right and who's wrong for it?
Right. Well, first of all, we look for patients that have a spinal deformity, and it's usually in adults that have an arthritic process where there aren't any other options for them. We look at a combination of their imaging test, and also we have to look at their overall physical condition, the other medical problems that they have. Can they tolerate a surgery of this magnitude? And one of the criteria we use is somebody that can walk 2 or 3 hours at a time is probably not going to appreciate that type of surgery. And my personal benchmark for doing these kind of deformity corrections is somebody that can only walk 10, 15, maybe 20 minutes before they have to sit down or lean on a shopping cart to do these larger kind of procedures. And then we spend several sessions in the office describing the procedure and the recovery period, and we really let the patient decide. When they're ready, the pain will let them know that they're done and they got to do something. So then desperate people do desperate things like these big spine surgeries.
That's unbelievable. Now, you've had a really big impact on not just the medical community here, but in other areas as well. Can you tell me about what you've been doing to sort of show how this works to other medical communities?
Well, I do scientific research on all sorts of things. And on this particular one, we followed all the patients that we've done for several years and collected the data, and I put together a scientific paper, and I presented it at international spine meetings. And then at times I'm also part of workshops showing other surgeons how to do these complicated techniques.
And could you ever have imagined, years ago, possibly 8 years ago is when you started this?
Yes. Mm-hmm.
8 years ago, could you have imagined the success or even the success story of someone like Bonnie coming out of this?
I don't think of that. I just, when I'm looking at these things, trying to make these work, my intent is I just want to help somebody.
Yeah.
I don't really care about success or not success. I'm really driven by helping the patient. And this is just a really kind of a wonderful side complication or just a result of it almost. So it is nice to see, but I really enjoy helping patients. So.
And Bonnie, I mean, are you up doing gymnastics now? You probably could. I mean, you were back in the gym as we saw in the video. I mean, what could you say to doctors, especially like Dr. Sweet, someone who's transformed basically something that you thought wouldn't be possible before?
Well, to Dr. Sweet, I would say, bless you. And thank you for going to medical school. Thank you for doing your part. For me, one of the things I'd like to do now is simply encourage others that there really is such a thing as a successful back surgery. For years prior to my surgery, I had never heard one. And now I realize that I didn't talk to the right people, that there really is something out there. Maybe not before, but there sure is now.
Oh, my goodness. Well, Dr. Sweet, Bonnie, I appreciate both of you coming. This is such a great story. What a success story. what an inspiring story to a lot of people out there who may be feeling pain as well. And Dr. Sweet, quickly, if someone is feeling like they need help, what do you recommend for them?
Call our office. We can't help everybody, but we're sure happy to look at everybody, or at least look at their studies and the information and see if we can help them out.
Wow, fantastic. Well, to both of you, thank you so much. Thanks so much for joining us.
Thank you.
We'll be back right after this break.